We are looking into the biomechanics measurement. We want to measure biomechanics because we want to understand the pressure better, and we also want to assess the risk for ectasia. So biomechanics is going to be very important for us to detect the risk of the disease before we have the disease developing. The Corvis is a dynamic shine fluid camera, which gives you 140 measurements in about 30 milliseconds. So these measurements that you can see the cornea deforming through the measurement of the non-contact tonometry. We are measuring corneal biomechanics today with the Corvis. The Corvis is a dynamic shine fluid camera with a very high frequency camera which takes 140 frames in about 30 milliseconds. So it allows you to monitor the cornea deformation through the non-contact tonometry. It gives you a lot of information about the corneal structure beyond corneal shape, which is something that we have done over 10 years with corneal tomography with the shine fluid camera and the Pentacam. This is important to detect ectasia. We are trying to detect ectasia risk before we have the disease. So we have this information that will be combined on the biomechanical information and tomographic information so that we can understand the risk or susceptibility to develop ectasia that any cornea has. We measure the corneal structure. We try to assess the cornea through the cornea deformation parameters. We try to assess how is the tissue behaving. And this is going to be very important for any type of procedure that we do on the cornea. It's going to be important to assess which patients will benefit from cross-linking, and of course, after cross-linking, to assess how we did really measure the effect on the biomechanical setting. We can do cross-linking again in some patients if needed. We can see changes from the cross-linking from different procedures for epi-on, epi-off, and different protocols so that we can really improve what we are doing to help ectasia patients as well.